There's some very concerning information and research coming out of Japan looking at the association between worse cancer prognosis in patients who have been boosted. It seems the Japanese are the only people who are asking hard questions, and they really seem to have got their their teeth bitten into discovering what is going on. So they are researching and looking now for issues. You have to understand that this is how it works in science. A lot of people think that by raising questions about stuff, you're just putting it down, you're just giving trouble. No, science should be about thoroughly interrogating anything, especially novel technology, and asking hard questions to make sure that it is safe for the public. So, what we'll be going through today is this paper. It's important to note that it is not yet peer reviewed. That means it hasn't been looked at by other scientists who may find issues with the way the study was done. But this is the title: Repeated COVID-19 Vaccination as a Poor Prognostic Factor in Pancreatic Cancer, a retrospective single center cohort study. As you can see, they are all based in Japan, single center. It was published on the 15th of April, 2025. Now, you can't extrapolate this to every other kind of cancer, but in truth, about 18 months ago, I had been looking into this and I had put together a whole presentation on this. It's been there for now about 18 months because, based on the science, this is what I anticipated. If you're interested, the link is in the description below. But I was looking at the general principles with regards to cancer, immunity specifically, and cancer. And this is very relevant to the paper today. And critically, this here, vaccine induced IgG4 and cancer. So you can see that this is not something that has come out of the blue. It has always been a question mark with regards to risk. And so this is why I'm saying is that for those of us who have been looking at this, it's sad, but it's not a surprise. In effect, what we need now is far more detailed research to clarify what exactly is going on. And just so that you understand, I'm going to show you from that presentation, just a couple of slides. One of the things that I did find, which has now disappeared, so this is one of the few places you will see it. I then went through the data looking at the UK statistics with regards to a number of cancer patients receiving first treatment, looking from 2020 to 2023. And dark blue was 2023, and this is month by month. And you can see that the dark blue was essentially elevated across the board. Some people said it was because of the time delay, but at that point in 2023, I think enough time had passed that if people were going to have cancer, they'd have it in 2021 and 2022. So 2023 here, at that time, was a concern for me. Interestingly, the data is no longer there, or they've changed the way that they share the data, so I wouldn't be able to get it again. And so that's a bit of a problem. But if you're interested, look at the presentation that I've got in the link below. Before we go into the paper, I'll just give you a little bit of basics around the science. What we're talking about is immunoglobulins, and they're making specific reference to IgG4. And so in case you don't understand what that's about, this is what they mean. Immunoglobulins are like, I call them the missiles of the immune system. A long distance, it's produced by plasma cells, and they can target viruses, bacteria, fungi, many things to trigger an immune response. You have multiple ones, IgGM, short term. We don't really talk much about IgD. IgG is the main one and the long lasting one. We'll come back to that. IgA tends to be for mucosal surfaces. IgE, that's what you get in allergies. So when you look at IgG, when you talk about long term immunity, it's usually IgG antibodies. Now, even that is then split into four. IgG1 tends to be the most long lasting and the longest elevated in the blood. and it triggers the immune system. IgG2, we don't talk much about, not a lot of research. IgG3 is a very strong activator of the complement system. So, again, 1 and 3 tend to be the main IgGs that trigger the immune system. But as usual, in every part of the body, you have a balance, and that's IgG4. IgG4 does not quite the opposite, but it kind of tells the immune system to back off, and says, don't worry, this is not a problem. You can almost think of them as the peacekeepers. If they attach onto something, they're telling the immune system, don't worry about it. This is not too much of a problem. And so it's what you would get with beekeepers, where they're being stung by bees all the time. You get lots of IgG4. So it tells the immune system, don't overreact to it. This is not a problem. And so that's the principle as to how IgG4 works. And as I reminded you, IgG4 tends to be more tolerant. IgG1 and 3 trigger the inflammatory response. And so this is where the question marks had been coming with regards to mRNA vaccines. And the reason was, and specifically something more to do with mRNA than to do with even the adenovirus platform, is that what they found is after the third dose, so first two doses didn't really trigger too much, but after the third dose, you had this very strange response, an almost 4,000% increase in IgG4. And you can see this is the third dose, and this is from the paper about class switch towards non-inflammatory spike-specific IgG4 antibodies. And you see this huge jump in the IgG4 levels. And critically, what the other thing that is happening is that there's a falling off of IgG3. The IgG1 remains up, IgG3 starts to fall, and IgG4 rapidly rises. So, and if you look at the sum total after the third dose, there is higher total immunoglobulins, but most of that rise is because of IgG4, reduced IgG3, stable IgG1. So this has always stood out as something very strange from a scientific point of view. And it has largely gotten ignored because I guess it was inconvenient. But the reality is that it was always an issue. One of the problems is that if IgG4 is impacting the immune system, how does that work in relation to ongoing infections, or even yet what happens in the context of immunity with regards to cancer? Now, an important thing, and I'll show you this slide. I'm trying to get some of my slides together so that you understand what I'm talking about. When you talk about cancer, cancer is not just something you get, all right? It has to have, I call it, 4 levels of failure before somebody can get cancer. The general health has to be off. There's usually some kind of toxin or infection that's contributing to it. Say, for instance, somebody who is smoking. They usually have some degree of genetic predisposition. So the combination, poor health, smoking, genetic predisposition, all of these together increase the risk. But the final piece of the puzzle is immune failure, because your immunity is continually killing cancer cells. This is what people don't realize. It's not that somebody just gets cancer. Your body continually has cancer cells being formed, because this is just what can happen as cells replicate. And some of them will then not want to die, and the immune system comes along and says, no, you are going to die, and it kills it. So that's how most people will survive without cancer. In truth, if all of us lived long enough, if you live to the age of 150, we probably all would probably get some form of cancer, with the connection with as our immunity got worse and worse over time. And so you have this situation where the immune system is an essential part as to what is going on. And I wanted to show you an important piece of this puzzle with regards to IgG4. But let's get to the paper, because that's the fundamental as to what we're talking about here. Now that you've got that background, we can then look at what the paper said. So as I said, if you've just joined, this is the Japanese paper published on the 15th of April, 2025. And they found that repeated COVID-19 vaccination was a poor prognostic factor in pancreatic cancer. It's not yet peer reviewed. So remember that, look at the date. In time, they may have to make some adjustments to it in order to get it done. As you can see, this shows where it was done, Department of Gastroenterology, Miyagi Cancer Center. And it was a single center study. Okay, that's the other thing that would go against it, in the sense that it's not broad across the whole country. It's one center that was done. And so when we look at the abstract here, what they were doing is that they were retrospectively examining the effect of vaccination on survival of 272 PC, pancreatic cancer patients diagnosed at our hospital between January 2018 and November 2023. So the first thing to note is that they are pre-pandemic. So they have a trajectory of illness. And so this is what they were looking at. And they were looking at multiple prognostic factors, including that IgG4 level that we had said. What they found was that the overall survival of pancreatic cancer patients was shortened in those vaccinated 3 or more times, and the total serum IgG4 levels increased with the number of vaccinations. So that's very important. And as I said, there are limitations. It's a single center study, but just the same, it's a good number of people that they were looking at. I'll try and see if I can get this to work, make it a little bit bigger. So what you can see is that they looked across the period of time, and this is looking at the probability of survival 2018, 19, 20, 21, 22, 23. So they picked the pandemic period as red, pre-pandemic or before vaccination as red, and as black, and after vaccination as red. And you can see generally that in the red period here, there is clearly shortened survival, because this is a time frame at the bottom here. So when they looked at the time frames, there was shortened survival after the pandemic. And if we go across here, this then does it as a block. You can see that black represents 60 months. When you look at red here, they barely are able to get beyond maybe 30 months. So this is a significant trajectory in terms of what they're finding. Now, this is the standout. When they broke it up in terms of number of vaccinations, 0 to 2 vaccinations is in black, and it's still a shorter survival than the 2018 to 2019, but compared to people who have had 3 vaccinations and the numbers are equivalent, this is very, very significant. So you can see 24 months up to maybe 40 months, 36 to 40 months. So this is quite a significant difference, and it looks consistent. And so it's very difficult to necessarily say that discount this information as being nothing. It's relevant, it's important. But more than just the fact that they have done this, they have also looked at the IgG4 levels, as I had said before. Let's make this a little bit bigger. And what it shows here is that number of vaccinations. You can see here, this was looking at FOX positive cells. We'll come to that in a minute. And the IgG4 levels in reddish here are higher and higher risk of these immune suppressive cells. We'll come to this in a minute, because that's a very important point with regards to why I think this is happening. When the other thing that they've done in Japan is, as usual, they're doing histology and histological assessments. And before I do that, just take a look here at the IgG4 levels. You can see here IgG1, IgG, the total IgG1, 2, 3. See how low the 3 is? And 4 is up. And this is what they found across the board with the patients who were vaccinated, spike-specific IgGs. So a significant proportion of the antibodies are IgG4, not IgG3. So it suggests that there is a degree of immune suppression occurring because you are losing a critical part of your immune response with regards to IgG3. We don't know why that bit is happening, but it is still quite important. The final thing, as I said, that they found was to do with the histology. So they looked at the tissue when they did the biopsy. I'm trying to get the image here for you so that you will see it. And they did the biopsy here, and they were looking for specific immune cells, what they call FOXP3. And this is showing you here what it looks like. So this is part of the pancreatic tumor. And what they're finding is that it is being infiltrated by these cells. So they're staining because these are actually immune regulatory cells. And so the regulatory cells are the peacekeepers, just like IgG4. So they're telling the immune system to relax, don't worry too much, we are here, don't start a fight because you'll cause damage. Now, this has a very important balancing effect in the context of many diseases, but in the relevance of cancer, where you need your immune system to destroy the cancer cells, these regulatory cells suddenly become a problem. It's almost like having the terrorists there. I guess this is what they're arguing about in the US. And you have regulatory people defending the terrorists so that you leave them alone. It is counterintuitive. Why would you do that? Because it's putting the whole system at risk. It's that kind of situation that you're getting with the regulatory cells. And they're closely linked to the IgG4, which is the tolerant antibodies. So when you have that tolerance in place, you then are unable to address the immune aspect of cancer. And that's effectively what it seems to be happening here, because the numbers are quite significant. When they looked again at IgG4 here, if IgG4 was low, you can see that's black, compared to elevated IgG4, worse, significantly worse outcome. Now, as I said, this is preliminary, it's not yet peer reviewed. I mean, I don't know what they would be able to find that would make it not get published. And even if they found an issue with it, it doesn't take away the premise that they are noticing, observing a trend. And this trend has to be addressed. I don't think it's logical. I genuinely can't understand why there isn't more concern. And I can only think that people can't be concerned because the implications are so serious. But for those of us who have been asking questions all the time, it really seems completely illogical. So now that you've seen that, you can see why they came to this conclusion. Their conclusion is these findings highlight repeated vaccination as a poor prognostic factor in pancreatic cancer patients and suggests that IgG4 is induced by repeated vaccination and may be associated with a poor prognosis in these patients. And that's their conclusion. And that's a reasonable conclusion. But as we're always told, correlation does not mean causation. And that's been the excuse that has been used for a number of years now so that you don't ask any questions. It just needs to be investigated. And again, I thank the Japanese. In time, it will be demonstrated that the world, the health of the world has been protected because the Japanese have done what everybody else should be doing. I think even now, if suddenly everybody kicked into action and they started to do the autopsies and they were looking, I don't know if they would get back any credibility because so much time has passed. Really, I mean, this is it's just unacceptable. How can you have left it for so long? And this is why I've been saying that those who were leading at this point, this kind of failure is unacceptable. And it's not in the interest of the health of the population. I don't know what excuse people can come up with. It's just not right. Thank you for the Japanese. And for those who do want to see more about what I predicted 18 months ago, what's very frightening is I've done a number of presentations like this for over the past few years. And over time, I don't even have to update it because it's just hitting on the science all the time. So if you are interested, please take a look at this. As I said, I've covered a number of areas here: overview of cancer, the immunity and cancer, my link to autoimmunity as to why this is happening, IgG4, interferon suppression, spike protein, and P53, the issue of vaccine contamination. All of these issues have been discussed in that presentation. There is a big sigh at this point. There is not much else that I think I can say other than the fact that I suspect the next 5 to 10 years is going to be quite difficult. But let's plod on. We'll keep on studying the science until we meet again.